This is another case. This is barium follow through study. As you can see, barium material inside the stomach, duodenal and jejunum. So you can appreciate a small surgical clips here, here one, and you can see that stomach is small in size and is distended and has a mottled lucency mass that is giving the filling defect in the stomach. So actually this is giving a appearance of gastric bezoar. You can appreciate this is mass and this is the filling defect, a large filling defect. And actually this patient was having a peptic ulcer disease for which a Billroth 1 procedure has to be done, in which you can see there is direct communication of the distal end of the stomach with the duodenum, and antrum part of the gastric, the stomach has to be removed, and the remaining part is rejoined with the duodenum. Here you can appreciate. In this case you can see that there is no leakage of this barium at the anastomosis site, and there is no perforation. You can appreciate there are small mucosa, smooth mucosa of both duodenum and the stomach. So when there is partial gastrectomy and antrum is removed in the treatment as a treatment option of the ulcer disease, then you know that the antrum has basic hormonal stimulus for increased acid production. That's why antrum part of the stomach has to be removed. And when antrum is to be removed, then the peristalsis of the stomach and HCl production of the stomach is diminished, due to which the food material is seen here and not digestible and not propulsed forward, because there is no peristalsis, decreased peristalsis and absence of HCl. So due to these both reasons, you can see the food undigestible food material is seen in the stomach. That is giving the gastric bezoar appearance. So whenever you see a gastric bezoar appearance, then always, apart from history of any psychiatric illness, always acquire about history of any surgery, any Billroth surgery and any vagotomy. In vagotomy you can also appreciate gastric bezoar, because in vagotomy there is decreased gastric production and there is decreased peristalsis of the stomach also. You can also get this picture. So this is a Billroth 1 procedure. In Billroth 2 procedure, there is direct communication of the stomach with the jejunum, and afferent loop. We also see an afferent loop apart from this joining aside. So and we will get more complication in Billroth 2. One complication will be that whatever you eat and this food that come into the stomach, that will take very little times to stay in stomach, and very early it will transfer to the jejunum. So empty time of the stomach will be shortened, and for very little time food will stay in the stomach, and as a result you will get abdominal pain, diarrhea in this condition. And the second thing will be in Billroth 2 procedure, there will be reflex bile gastritis, because the afferent portion of the duodenum in Billroth 2 will take secretions of the pancreas and bile, and that when these secretions will go towards the stomach, they will re-enter into the pylorus, because in Billroth 2 procedure, pylorus of the stomach has also been removed. In Billroth 1, most of the pylorus part is to be present, that stop the bile secretions to enter duodenum to the stomach. But here in Billroth 2 procedure, there will be that mechanism has to be lost. The when there is a very little time of the food to stay in stomach will take, then this syndrome is called to the dumping syndrome. In dumping syndrome, there will be very food will take very little time to stay in the stomach. So these two complications has to be associated with Billroth 2 procedures. So that's why surgeon try its best that first procedure has to be done will be it should be Billroth 1. But when Billroth 1 procedure can't be taking place, then Billroth 2 procedure has to be done. So the condition where there will be extensive ulcers that not include the that not present in the stomach but also present in the duodenum, then Billroth 2 procedure had to be done. Or in cases where there will be extensive fibrosis that involve both of the stomach and duodenum, in that condition we will do for Billroth 2 procedure. But Billroth 2 procedures have more complications. So this is a case of Billroth 1 procedure with undigestible food material in the form of motile lucencies and filling defect in the stomach is appreciated. Thank you very much.